Hello everyone, welcome to the Heroes Initiative powered by IPCA. These heroes are instrumental in improving quality of life of the patients. Today we have one such hero who has improved life of tens and thousands of such patients. Doctor, we welcome you to the Heroes Initiative by IPCA. So doctor, now we are focusing on cataract surgery pre and post-operative care. So doctor, my first question for you is, what should I expect during the pre-operative assessment for cataract surgery? Are there any specific preparation do I need to make, doctor?
Pre-operative cataract assessment has to be there, and you need to investigate patient for the clinical investigations. Like blood sugar, you have to see whether patient is a diabetic, then you have to see for a fasting and post-meal sugar. And if the patient is not diabetic, then patients we have to see for the random sugar. In the same way, some patients are undergone with angioplasty or angiography. In that case, sometimes you have to stop the eposprin or aspirin or clopidogrel tablet. So these are the pre-operative investigations. You have to check whether the patient is undergone any angioplasty surgery, whether patient is a diabetic or a non-diabetic. Third thing is patient, you have to start so many times the antibiotics before the operation, 2 to 3 times in a day. So these are the pre-operative things you should take care before the operation.
What are the most important post-operative care steps to ensure a smooth recovery after cataract surgery, doctor?
After the post-operative surgery, you should, if you are a diabetic, you should always control your sugar in a very particular manner, that it has to be very under normal conditions. It has to be around 150 to 170. And post-operative eye drops, you have to put it very meticulously and follow the instructions of the eye doctors who has been operated your eye. So if 2-3 things if you are following, there will be 100% smooth recovery after the operation. As here in Deshpande Eye Hospital and Laser Center, we do all surgeries with a cataract base, or you can say as a bladeless cataract surgery. So in that scene, the recovery is very fast. Within 2 to 3 days, 100% patients get recovered. And the incision size is very less nowadays. That's why the recovery in diabetic, particularly diabetic patients also, the recovery is very fast. So nowadays cataract recovery is very fast. Also the complication rate is very less.
Are there any common complications after cataract surgery and how they can be managed or prevented?
If you follow meticulously the instructions whatever given by your operating surgeon, then I don't feel that any complications does happen. Post-operatively, especially at the time of the operation, sometimes some complications can happen. Or post-operatively, if the patient is not maintaining the proper diet or proper follow as per the instruction, if he is not putting the drops, in that scene only you can see that some complications may happen. But if you are following instructions and putting the drops particularly, then I don't feel that any complications will happen.
So doctor, your expertise and insights on cataract surgery pre and post-operative care are invaluable to this initiative, and we believe your participation will greatly benefit the patients.